Hey guys, welcome to the OT Minute. My name is Arno. In today's video, we're going to be doing a quick review of spinal precautions. Now, I do want to make a note that this video is not intended for individuals who have had a back surgery recently or who are looking to have back surgery in order to educate you on your spinal precautions. Highly recommend you talk to your surgeon about it because there are variances and you want to make sure that you're doing what your surgeon recommends. This video is more so intended for OT students or OT practitioners who are now starting to work with individuals with spinal cord injuries. Let's start with the basics of spinal precautions, and that includes this acronym that you'll hear often, no BLT, meaning no bending, no lifting, and no twisting. No bending and no twisting refers to the spine, so we want to make sure we are not bending the spine or twisting the spine. When it comes to lifting, we want to make sure that we aren't lifting more than 10 pounds. So an individual with a spinal cord precaution needs to be very careful on how they're carrying things, how much weight are they carrying. Keep in mind that education about body mechanics can be really helpful because lifting something close to us that's 10 pounds, for example, versus far away from us that's 10 pounds, it's very different. Now, there are some nuances to spinal precautions that's good to know. For many institutions or surgeons, no lifting overhead is also included in spinal precautions. Also, for lumbar surgeries, many surgeons or institutions will have precautions where a patient also can't flex their hip more than 90 degrees. And the reason for that is as you flex your hip more than 90 degrees, the lumbar spine tends to bend. So you want to be careful with that as well, especially when you're thinking about lower body dressing, showering and washing feet, anywhere where a patient might lift a leg or cross their legs to help them accomplish an occupation. If you're thinking about working with individuals in this space, I would highly recommend reviewing your adaptive lower body dressing techniques and adaptive equipment that can be helpful. And then also review the different levels of spinal cord injury so that you can kind of know what to expect on evaluation and where to focus on treatment. And then also review your neuromuscular re-education frameworks such as NDT, PNF, RUD, and Brunstrom. Hopefully with that, you've got some helpful information to know what spinal precautions are and some things to look out for, some of the nuances that you might run into. Always keep in mind that if you have questions, go back to the physician or the surgeon, ask questions. It never hurts to clarify to make sure to keep a patient safe. Thank you for your time. I'll see you in the next video.